I would like to welcome everyone to the March 24th, 2020 work session of the Henrico County School Board. At this time, I would like to make note of Mrs. Ogburn's physical absence from today's work session. She previously notified myself, the chair, that she has requested to participate electronically from a remote location due to a personal matter. Our school board policy P2-04-006, electronic participation in meetings from remote locations, requires a majority vote of the board members present at the primary or central meeting location to allow a board member to participate in a meeting from a remote location. In accordance with this policy, do I hear such motion?
I move that the school board approve Ms. Ogburn's electronic participation in today's meeting for a personal reason.
Moved by Mrs. Kinsella. Do I have a second?
Second.
Seconded by Reverend Cooper. Roll call vote. Ms. Atkins?
Aye.
Ms. Kinsella?
Aye.
Reverend Cooper?
Aye.
And I vote aye. Mrs. Ogburn's request has been approved. This meeting is being live streamed on the HCPS website. We'll begin our meeting with a roll call. When I call your name, please verbally indicate your presence. Reverend Cooper?
Present.
Mrs. Kinsella?
Present.
Mrs. Ogburn?
Present.
Mrs. Atkins?
Present.
Thank you. Let the record and I myself am present. Thank you. And please let the record reflect that a quorum of the board is physically present and Ms. Ogburn is participating electronically. I ask Ms. Ogburn to verbally note if she needs to leave the meeting and subsequently verbally note when she returns. The first item on our agenda is the approval of the agenda. Is there a motion to approve the agenda?
I move that the school board approve today's agenda.
Thank you, Reverend Cooper. Is there a second?
Second.
Seconded by Ms. Atkins. Roll call vote. Reverend Cooper?
Aye.
Ms. Kinsella?
Aye.
Ms. Ogburn?
Aye.
Aye. Ms. Atkins?
Aye.
And I vote aye. The agenda has been approved. The next item on the agenda is a closed session. Is there a motion to go into closed session?
I move that the school board go into closed session for the discussion of matters covered under item A1 of section 2.2-3711 of the Code of Virginia, 1950, as amended, pertaining to the assignment, appointment, performance, disciplining, and release of contract for specific school board employees.
Thank you, Ms. Atkins. Is there a second?
Second.
Seconded by Ms. Ogburn. Roll call vote. Ms. Atkins?
Aye.
Ms. Ogburn?
Aye.
Ms. Kinsella?
Aye.
Reverend Cooper?
Aye.
And I vote aye. The ayes have it. We will now go into closed session. We will reconvene the work session at the conclusion of our closed session. Welcome back. Is there a motion to certify closed session?
I move that the school board certify by a recorded vote that to the best of each school board's members' knowledge, only public business matters lawfully exempted from the open meeting requirements of the Virginia Freedom of Information Act and identified in the motion authorizing the closed meeting were heard, discussed, or considered in the closed meeting.
Thank you, Reverend Cooper. Is there a second?
Second.
Seconded by Ms. Kinsella. Roll call vote. Reverend Cooper?
Aye.
Ms. Kinsella?
Aye.
Ms. Ogburn?
Aye.
Ms. Atkins?
Aye.
And I vote aye. The ayes have it. The closed session has been certified. Dr. Cashwell.
Thank you, Chair Shea, members of the board. For the first item, I am recommending that the school board approve the appointment of administrative personnel.
Thank you. Is there a motion?
I move that the school board approve the appointment of administrative personnel.
Thank you, Ms. Atkins. Is there a second?
Second.
Roll call vote. Ms. Atkins?
Aye.
Ms. Kinsella?
Aye.
Ms. Ogburn?
Aye.
Reverend Cooper?
Aye.
And I vote aye. The ayes have it. The administrative appointments are approved.
Thank you. The members of the board, you have just approved, effective July 1, Dr. Cassandra Willis, to be the next principal at Montrose Elementary School, Mrs. Ellen Gonzalez to be the next principal at Echo Lake Elementary School, and Dr. Jessica Burbick to be the next principal at Short Pump Middle, as well as Dr. Heather Allen to be the Assistant Director for Policy Constituent Services. Welcome to our new appointees. All right, for the next item, we have our COVID-19 health and safety update, and Dr. Tigan is coming forward to present that update for the board, and as always, we'll be happy to answer any questions you have following that presentation. Dr. Tigan?
Give a second to get the... Good afternoon, Chair Shea, members of the board, and Dr. Cashwell. Thank you for the opportunity to provide an update on the COVID-19 health and safety efforts in Henrico County Public Schools. Today's agenda includes a review of the current COVID community level, a quick review of the efforts to host COVID and VDH mandated vaccination clinics for students and staff, a summary of the continued COVID testing opportunities, a reminder of current clinic practices and timeline for possible changes, and a comparison of the symptoms of COVID-19 to those of seasonal allergies. So starting with the community level, this chart shows the interrelationship of the three metrics used to determine the community level. You were first shown this at the last meeting. Overall, our metrics continue to improve in Henrico. As of this past Saturday, March 19th, the county has fewer than 200 new cases per 100,000 people within the past 7 days, as the actual number of new cases is 58.04 per 100,000 persons. 5.8 new hospital admissions due to COVID-19 in the past 7 days, and on average over the last 7 days, 2.7% of the staffed inpatient beds were occupied by COVID-19 patients. Thus, the community level for Henrico County remains low. Again, I think this is something to celebrate. As shared previously during these updates, the Henrico vaccination rates contribute to these low numbers. By next Thursday, the end of March, the second rounds of school-based clinics at the Title I elementary schools will be completed, and no additional COVID vaccine clinics are being planned at this time. As shared 2 weeks ago, as there is less demand for COVID vaccines and boosters, there is still a need for greater access to the Virginia Department of Health mandated vaccinations and boosters. Given the success of our school-based COVID clinics, the health department is partnering with school health services to offer school-based clinics for the mandated vaccinations and boosters for our middle and high school students. These include the following: required for 7th grade, the tetanus, diphtheria, and acellular pertussis, or Tdap booster, and that must be administered on or after a student's 11th birthday. They also, our 7th graders, have to have the first dose of the human papilloma virus vaccine, or HPV, and they lastly must have the first dose of the meningococcal conjugate vaccine. And our seniors have to have, our rising 12th graders, have to have the second dose of the meningococcal conjugate vaccine. As the school-based clinic dates and times are confirmed for these VDH mandated vaccines, more details will be shared with families. As you see on this slide, Henrico continues to offer lots of opportunity for student and staff testing, as testing remains an important mitigation strategy. As shared at the last board meeting and in the last issue of the Clipboard, which is Henrico's staff newsletter, staff may request additional kits prior to spring break should they want to test before heading out on vacation and again before they return to work on Monday, April 11th. The final topic for today is clinic practices. The current clinic practice is for any student with COVID-like symptoms to be sent home with a COVID test kit. Students must test before they return to school, or they stay out until day 6. Staff continue to monitor the local COVID metrics and will continue to do so throughout spring break. If the current trends continue, the testing requirement when students present with COVID-like symptoms may be eliminated. This topic will be discussed again at the April 21st school board meeting. But any changes in clinic practices, such as reverting to allowing students to return to school in 24 hours, as long as they are fever-free for 24 hours without any fever-reducing medication, would not go into effect until April 25th. Whenever COVID testing is no longer required to return to school after experiencing COVID-like symptoms, families will still be able to get a take-home test kit from the clinic should they want to test their student. And lastly, because allergy season is upon us, this chart provided by the Center for Disease Control and Prevention will be shared with school nurses through the school health services and with our families through this week's edition of the binder. Unlike COVID-19, seasonal allergies are not caused by a virus. Seasonal allergies are immune system responses triggered by exposure to allergens, such as seasonal tree or grass pollens. COVID-19 and seasonal allergies cause many of the same signs and symptoms. However, there are some differences as shown on this chart. If families are in doubt as to whether a student has allergies or COVID-19, they may request a test kit from their school clinic. And at this point, I'm happy to answer any questions.
Thank you, Dr. Teigen. I think you've set the record for the shortest COVID-19 update that we've had in 2 years, so well done. All right, Ms. Atkins, any questions?
No questions.
Thank you, Ms. Ogburn. Nope, that looks like a nope. All right, Ms. Kinsella?
I guess the only thing I would ask for a point of clarity for those listening is that if you need to have a test, can you still email it to the school? Because I know there's been some confusion among our schools. What exactly do you have to do
Right,
so that you can return to school?
If you get a test, whether it's using one of our test kits or one you may have gotten through the federal government or at a local pharmacy, or even your physicians, you can email those results to the school nurse, and you might want to copy an administrator, and that will suffice. And just let them know when your student comes back to school that they have a copy of the negative test results.
Okay, so an email is accepted.
Yes, ma'am.
Thank you so much. That's all I had, Chair Shea.
Thank you. Reverend Cooper?
No questions, thank you.
And in an all-time record, I don't have any questions for the COVID-19 update. So we thank you, Dr. Teigen.
Thank you very much.
All right.
Dr. Teigen, and as she indicated at our April board meeting, she will hopefully bring us another swift update, but we'll also revisit the topic mentioned. All right, so for the next item, I am recommending that the school board approve the Instructional Material Review Committee, or IMRC's recommendation. And you'll recall, based on material provided to the board in advance of this meeting, that this is related to challenged material in our library high school collection. Again, this is library material not required reading. The committee reviewed that material for developmental appropriateness and has recommended it remain in our high school library collection, and I am seeking the board's approval of that recommendation.
Thank you, Dr. Cashwell. Any questions, Reverend Cooper? Ms. Kinsella?
No questions?
Ms. Ogburn? I can't see you, and I can't see you, and I can't hear you.
Sorry. Is that better?
Yep.
Okay. This was material that was in our high schools, but I was just curious, was the book in question in our middle schools? Because I actually had a parent who said that it was, but I'm not sure that's correct information, because sometimes things move from one level to another. So this is just high school, right?
Correct. This title is and was part of the high school collection, library collection.
Okay, thank you.
Thank you, Ms. Ogburn. Ms. Atkins? All right. And then my only question, which you already stated, but just to restate, this is not required reading. This was just available in the library.
That's correct.
Okay, thank you. All right, no other questions or comments. Is there a motion to approve and adopt the IMRC's recommendation?
I move that the
move.
school, go ahead, Ms. Atkins.
I move that the school board approve the Instructional Materials Review Committee's recommendation.
Thank you, Ms. Atkins. Is there a second?
Second.
Seconded by Reverend Cooper. Roll call vote. Ms. Atkins?
Aye.
Ms. Kinsella?
Aye.
Ms. Ogburn?
Aye.
Reverend Cooper?
Aye.
And I vote aye. The ayes have it. The IMRC recommendation has been approved and adopted.
Thank you. The next item, which is under operations, is related to middle school student and staff and central office laptops. You've been provided information related to that effort to purchase laptops both for the middle school staff and students in central offices, and also some server infrastructure pieces related to middle and elementary. While not seeking your approval for anything here, wanted to provide that information and offer the chance, should you have any questions. Mr. Maddox is here, as well as Mr. Pritchard. Any questions on that?
All right, doesn't look like it.
All right, and next, have information also for the board's review in advance of seeking any approval related to the Dominion Energy Virginia right-of-way agreement at Carver Elementary School.
Any questions, comments? All right.
And that concludes any items I have for the board.
All right. The next item on the agenda is unfinished business. Colleagues, do you have any unfinished business? The next item on the agenda is new business. Colleagues, do you have any new business? No. The final item on the work session agenda would be announcement and meeting dates. Anybody have any announcements? All right, the next meeting date, we do have a monthly meeting tonight at 6:30 right here in Newbridge Auditorium. And then the next work session scheduled, as a reminder, we only have, because of spring break, we only meet once in April. So on Thursday, April 21st, 2020, there's a 1 o'clock scheduled work session and a monthly meeting at 6:30. The meeting times may be adjusted if needed. Setting more records today. This meeting is adjourned.